Hello, good morning everybody. My name's Marvelous Kankombwe. I am a student at the Northern Technical College. During my free time, I do some humanitarian acts. So during this period, I was free from all the work and everything. So I decided to do some humanitarian act. I decided to make a video about HIV and AIDS. To be specific, I am making this video about how one can prevent the transmission of HIV and AIDS. So to begin with, I would love to give a quick brief knowledge about what HIV and AIDS is. Okay, so as they are separated by the word "and," HIV and AIDS are two different things. HIV is a virus. The acronyms HIV stand for Human Immunodeficiency Virus, while AIDS, the acronyms AIDS stand for Acquired Immunodeficiency Syndrome. So, HIV is a virus, and it is actually a virus that attacks the body cells that are involved in fighting against infections. I'm going to give an example how the body operates. The body actually operates like, I'll give an example of a country, the way it operates. A country has got the military that are involved in fighting against all enemies that would want to attack the country. And those are placed in place way before an enemy attacks. So the body functions. The body has got white blood cells that are involved in fighting against infections. Way before an infection comes in, there's a mechanism that the body has developed to fight against infections. So what HIV does, the virus HIV does, it goes to the body and attacks those warriors that are in your body. It attacks those cells that fight against infections. So when those warriors, those cells, they are defeated and destroyed, any infection that is going to come is going to penetrate into your body and you're going to be sick of that infection. So that is the danger of HIV. It only weakens your immune system. It weakens your defense system. And when HIV is not treated, that is when it progresses to AIDS. So before I can talk about exactly how one can prevent HIV and transmission, HIV and AIDS transmission, I would love to talk about how one can acquire HIV, because you cannot prevent yourself if you don't know how you are going to get the virus. So some of the common ways one can actually contract HIV, they involve sexual contact. Any form of sex can transmit HIV and AIDS. Oral sex can transmit HIV and AIDS. Vagina to penis sex can transmit HIV and AIDS. Anal sex, any kind of sex can transmit HIV and AIDS. So that is one way. Another way one can contract HIV is through sharing of sharp objects. When one who has got HIV and AIDS has used that sharp object, they have ate themselves, and within some specified time, another one who is HIV negative uses that particular object and they hate themselves, one can get HIV and AIDS. Another way is the vertical mode of transmission, which happens between a mother and their baby. And this can actually happen in instances during pregnancy, it can happen during childbirth, and it can also happen during breastfeeding. And the other way is through blood transfusion. If you are HIV negative and you go to the hospital and they infuse blood from a positive patient, you can get HIV and AIDS in that way. So I want to talk about my interest is talking about how can we prevent this pandemic that has come upon us. So as youths, we can fight against HIV and AIDS. As a nation, if we work together, we can fight against HIV and AIDS, and we can live in a country where there is 0 new HIV infections. We can completely combat HIV and AIDS. So what are some of the means that have been recommended to prevent HIV and AIDS? And of course, the most effective way to the youths that are not of age, to have sex, it is abstinence. Abstinence, iriche. Abstain from sex, and of course, you're going to be safe from STIs, you're going to be safe from HIV and AIDS. Now, what about those that are involving themselves in sex? How can one prevent HIV and AIDS transmission? So I want to talk about this. Whether you are HIV positive or HIV negative, you can play a role in the prevention of HIV transmission. If you're HIV positive, there is what we call the viral load. The viral load. So somebody who is HIV positive can be taking treatment, can be on treatment, and the viral load can be highly suppressed to an extent where the laboratories cannot detect that one has got HIV and AIDS. So HIV cannot be cured, but the viral load can be suppressed. So once the viral load is suppressed, that person who has got HIV, the person who is HIV positive, one is going to live a healthy and longer life, and two, they cannot pass HIV to their partners who are HIV negative. So that is one way a person who is HIV positive can participate in the prevention of HIV and AIDS transmission. Another way is a way where both are involved. So if you're HIV negative, you are supposed to prevent transmission. You're supposed to protect yourself from contracting HIV and AIDS. What are some of the options that are out there for you to actually protect yourself from HIV and AIDS? Number one, I'm going to talk about the use of condoms. So there are female condoms and there are male condoms. A condom is supposed to be used consistently and correctly. There is a way a condom must be used, and it must be used consistently whenever you want to have sex. So it has been proven that if a male condom can reduce HIV transmission up to 90%, 90% chances, it can take away 90% chances of you getting HIV and AIDS. And the female condom reduces the chances to 94%. So it's a 94% effective. So use the condoms consistently, use them correctly, and you're going to be safe from pregnancy, you're going to be safe from STIs, you're going to be safe from HIV and AIDS. So another means of preventing HIV and AIDS is using HIV and AIDS preventive medicines. So these preventive medicines, you can find them in the hospital, you can find them in the clinics, at any health providing center. You can find the HIV medicines. So I'm going to talk about the first one, which is called PrEP, pre-exposure prophylaxis, in the acronyms PrEP. So PrEP is a drug that one who is HIV negative can take to prevent HIV and AIDS. So how is it used? PrEP, as the name suggests, it is pre-exposure. Before you are exposed to HIV and AIDS, you prepare yourself, way before you are exposed to HIV and AIDS. So PrEP is a drug that you can take and it can prevent HIV and AIDS. How does PrEP work? PrEP works in a way that when you get in contact with a person who is HIV positive, or when your body gets exposed to the HIV virus, it fails to get hold of your warriors. It fails to get hold of your cells. They fail to operate. So PrEP is a drug that you can take. So when you go to the hospital, they are going to advise you on how you can use PrEP. But what you have to know is that PrEP must be prescribed by a medical practitioner.